I'm Marcus Plescia, Chief Medical Officer at the Association of State and Territorial Health Officials. As we work to get one step ahead of the COVID-19 pandemic, state and local health officials are facing an urgent need to expand our contact tracing as we shift to recovery and containment efforts. I'm going to provide you with a brief overview of a recent report ASTHO co-authored with Johns Hopkins Center for Health Security on how to take our infection control efforts to scale to control this outbreak. Basically, in this report, we make the case that in order to effectively manage COVID-19 and prevent another surge of infections across the nation, we need to do two things. First, we need to assure ready access to rapid diagnostic tests for all symptomatic cases or those with a reasonable suspicion of COVID-19 exposure. And second, we need to increase our ability to safely isolate those who test positive, trace all contacts of reported cases, and quarantine those who've been exposed. Until a COVID-19 vaccine is available, management of the COVID-19 pandemic will rely heavily on traditional public health methods for case identification and contact tracing. These are the same methods we currently use for tuberculosis, sexually transmitted infections, and vaccine-preventable disease control across the nation every day. For COVID-19, we need an unprecedented and rapid scale-up of this public health workforce that's dedicated to case identification and contact tracing. In our report, based on analysis of the successful containment efforts that have been done in South Korea, Singapore, China, Iceland, and New Zealand, we estimate that 100,000 contact tracers will be needed across the country. While this figure may seem stunning, it's still the equivalent of less than half the number that were employed to control the epidemic in Wuhan City. Now is the time for Congress, the administration, and the country to come together to adequately fund and implement contact tracing at this required scale. Now is the time for state health departments to develop the workforce we need at the state and local level. How do we do this? At a time in our country when many Americans have lost their jobs, there's a willing, motivated, and available workforce in all of our communities. Health departments could potentially hire directly from the community under the more permissive conditions of state emergency declarations. State and local health departments may also be able to repurpose staff or bring back furloughed workers like school teachers and librarians. And finally, perhaps the most realistic scenario is for states to contract with other agencies like universities, schools of public health, or other local non-governmental organizations to hire these staff. Or we could work directly with other trusted partner organizations in the community that have recently had to lay off workers like the YMCA, faith-based organizations, and local charities. Ultimately, strategic management, training, and support for this workforce will also be necessary, and technology must be explored as a force multiplier. There is no question that the goal of adding at least 100,000 new contact tracers in the United States and managing their work will be challenging. It's achievable with appropriate financial support and a collective commitment, but it will require leadership and urgency from our public health leaders. ASTHO wants to thank Johns Hopkins Center for Health Security for their work. I'm Marcus Plescia. Thanks for watching.